Morning, I am Dr. Malik. We will talk about an important topic today. See, most of the diseases are classified like, hereditary, acquired, idiopathic, drug-induced, iatrogenic. That means most of the diseases come into some categories. Some are hereditary because they come in family history will be there. If there is family history, it is called hereditary. Number two is acquired. Acquired means, you get it because of your bad diet, or you don't do exercise, or you are using multiple gadgets, or you are exposed to chemicals in your factories, etc. So all these environmental factors, everything comes under acquired. Acquired means you got it on your own because of your bad atmosphere, environmental, bad diet, no exercise, etc. And number three is idiopathic. Idiopathic means there is no reason. Idiopathic means there is no reason for the disease you got. Okay, there is no reason. And lastly comes drug-induced or iatrogenic. Drug-induced or iatrogenic. 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 That means these are the problems which are induced by the medicines you are taking, or suppose you get admitted for one disease in one hospital, you get another disease. It is called iatrogenic. Iatrogenic means doctor induced or hospital induced or drug induced. Okay, all this drug-induced or iatrogenic. Iatrogenic means it is caused by the medication or by the your treatment, doctor's treatment. This is called iatrogenic. Okay, but nowadays I made one or two topics earlier also. 100% diabetes, one topic I made, 100% diabetes. And one more topic, this is very important, 100% diabetes, I made one topic. In this I clearly told, about 30 years back, when I am asking people, I am an anesthetist. Before giving anesthesia, I ask hard workers, mainly hard workers. I ask people whether they are diabetics, hypertensives, thyroid patients, etc. So, out of 10, 2 used to reply as, yes, I have diabetes, I have hypertension, etc. I have BP, I have thyroid, etc. Only 2 people. But nowadays, 6 out of 10 are frankly saying I am a diabetic, I am a hypertensive, and 4 out of 10 they say that yes, I have thyroid also. These are the common things. That means to say that it is not only hereditary. These things, example, BP, hypertension, thyroid, obesity, and this is paralysis. Example, CVA, cerebrovascular accident, whether it is internal bleeding in the head or any blood is not reaching the brain. These 2 things can be CVA, or heart attacks, MI, cancers, breast cancer, etc. and heart diseases. These are supposed to be hereditary once upon a time, but these things are nowadays acquired by your bad diet, bad environment, etc. So what I am seeing is, it is only 50% hereditary and 50% acquired. That is, you are getting because of your bad environment, your bad diet, no exercise, etc. So these are the things to be. So how to know, how to prevent them? How to prevent them is very, very, very important. Those things which are thought to be hereditary are no more only hereditary. They have other factors also, and you are getting on your own. Most of the diabetics, hypertensives, nowadays we get patients, they say my father had no diabetes, my mother had no diabetes, in family there is no diabetes history, there is no family history of heart disease, there is no family history of hypertension, BP, etc. So people are getting on by themselves, not by hereditary. Hereditary factors will be there, but 50% hereditary and 50% acquired. That means they are getting because of their diet, environment, etc. So what to do? How to prevent? How to detect these things? So don't go for multiple checkups every year, annual checkup, every 6 months, annual full body checkup. These are not the things to be done. Unnecessarily you will get so many doubts in the brain. You will become a hypochondriac. What is hypochondriac? Hypochondria means thinking that you have a big disease inside. That is a problem, hypochondria. They will be coming to doctors asking so many questions, but doctors say no, but they are not happy. That is called hypochondria. It is a psychiatric problem. So never go for multiple tests or screenings or every 6 months total body checkups. These are waste. Only thing is, check your BP and sugar. You have your own BP machine. You have your own sugar machine, small one, very cheap nowadays. Have at home. Check your BP, check your sugar whenever you are in doubt, or at least once in a month. Please check once in a week, or once in a week BP, once in a month sugar if you are not a diabetic. Okay, please check BP, sugar. These are the fundamental things. BP and sugar. These are the fundamental things to be checked. Number 2, serum creatinine. Serum creatinine indicates your kidney level. Nowadays we are seeing so many kidney patients, renal failure patients, kidney failure patients. So please check your serum creatinine at least once in 6 months. And particularly when you have some pedal edema, suppose there is your legs, your feet are swelling after some little walking or anything like that. Please always check your serum creatinine. Serum creatinine indicates your kidney health status. Kidney health status is very, very important. Nowadays we are seeing very common kidney failures are very, very common. So please check your serum creatinine at least once in 6 months. And same thing, once in 6 months, serum cholesterol, HDL, LDL, triglycerides, serum cholesterol, serum lipids we call it. So please check them occasionally. See, previously cholesterol, triglycerides, LDL, HDL were very, very, very significant. But nowadays there is some relaxation, because they say that sugar is more dangerous than cholesterol. Sugar is more dangerous than cholesterol. This is the recent norm. So sugar is more dangerous. Consuming sugar is more, that is consuming carbohydrates is more dangerous than consuming fats. That's what they say nowadays. So 6 months, once in 6 months you can get your lipids, cholesterol, triglycerides, LDL, HDL, etc. HDL is good cholesterol, LDL is bad cholesterol, you know that. Okay, so if HDL is high, it is good, LDL should be low. Okay, and ECG is not that important. Suppose you have a chest pain, you have a doubt, go and get the ECG done. That is very important. But when you have no pain, nothing, ECG is not that important, because it doesn't. ECG is important only when there is a chest pain. Suppose you have any doubts of chest pain, any doubts of mild heart attack, then immediately ECG is very, very important. Sometimes ECG and another blood test, troponin I. Troponin I is the blood test we do, because early stages it becomes positive. So ECG along with troponin I is usually done, but this is when your symptoms start, when really you have a heart attack symptoms. But before that, suppose you want to get tested whether you are going to get a heart attack in near future. In near future, you are likely to get a heart attack. You have doubts. Your father had heart attack. Some family history, and you have high lipids. For example, like cholesterol and all are little high. You are taking medicines for it. You want to get checked whether you will have a heart attack in near future. Then there is a test called calcium score, CT calcium score. CT calcium score is only when you don't have symptoms. You don't have any chest pain, but you want to get the doubt cleared. Okay, so this is the heart. It has 3 blood vessels which supply the heart. There are 3 blood vessels which supply the total heart. This is left coronary, this is right coronary, this is circumflex. There are 3 arteries which supply the whole heart. The whole heart is supplied by 3 blood vessels. So take this blood vessel. This is one vessel. These are small plaques which are there inside the blood vessel. As the age is advancing, the triglycerides, cholesterol, etc., they slowly start developing. Here small plaque, this is called plaque. Here triglycerides, cholesterol, some blood components, they all mix and form a plaque. This plaque can be soft or hard. soft or hard. Initially they are very soft, and usually a soft plaque causing obstruction is very rare. Soft plaque causing heart attack is very, very rare. When there is blood flow is stopped, only heart attack will come. Okay, so soft plaque will not usually damage, but sometimes in young people, sometimes this soft plaque can rupture and cause heart attack. Very rare, very rare. So usually what happens, once these are soft plaques, inside calcium is deposited. Calcium, first soft plaque will appear, after that calcium gets deposited inside. Then only it becomes hard, and you are liable to get a heart attack in near future when there is some obstruction, because this is hard, it is not flexing, it is very hard. So you want to check the calcium inside this plaque. You want to check the calcium inside this plaque. How much is the calcium? If the calcium is very low, you are little safe. If the calcium is high, then there is a chance of getting heart attack. So this is called CT calcium score. Just 10 to 15 minutes test. No, not even a single injection is given. Directly you will be taken to the CT scan. 10 to 15 minutes procedure, and you can rule out of getting a chest pain or heart attack in near future. Okay, so this is called CT calcium score. But if you are already having pain, if this is only when you don't have pain. So if you are already having pain, if you are already doubtful of some mild heart attack, it is better you go CT angio. CT is computer, CT scan. So CT and computerized tomography, CT angiogram. What is CT angiogram? We just give a small injection. And then take you to the CT and see. All the 3 blood vessels will be seen. With the injection, is because the drug is flowing inside. All the 3 blood vessels will be seen, and you will know how much block is there, whether it is 30%, 10%, 20%, and 70%. What is the blockade in each artery? So this gives a very, very good clear picture. It is a non-invasive procedure. Simply one small injection is given and CT angiogram is done. So these are the CT calcium score and CT angiogram. These are the main 2 things which you can get it done. And rest of the big tests like total body checkups and all, I don't think they are really necessary unless advised by a doctor, unless advised by your physician to specifically undergo some scanning, some brain scanning, some abdomen scanning, anything. See, these are only individual things. Suppose you have some problem, you go to a doctor, he advises particular tests, you can get it done. But on your own, getting every 6 months, every 1 year, total body checkups and all will create unnecessary doubts, because I will tell you very frankly, there are multiple biochemical reactions in the body, and so many cells. A cell dies in 100 days, again new cell forms. That is, cells are constantly growing and coming down. And one more thing I wanted, that's why the body is not a static one, it is continuous equilibrium. New cells come, old cells die, new cells come, old cells die. This is the thing. So please don't go for unnecessary investigations. And one more thing is diet. Diet is the main thing. Previous also I told you diet is the main thing. And if some diseases are hereditary, okay, we are aggravating them by our diet. For example, BP, hypertension, obesity. Even if you have some family history, you can prevent them by modifying your diet. Only thing is, previously they used to say in 1970s, they used to say you shouldn't take fats. Those days they used to say 70% carbohydrates, 25% protein and 5% fats. Now the schedule has changed. Now everybody, all the doctors, they believe that fats can be liberally taken, fats can be taken little more, carbohydrate should be reduced, and protein should also be taken liberally. So carbohydrate should be taken to a lesser extent, and not simple carbohydrate. You must take complex carbohydrates which do not get converted into glucose fast. So conversion of carbohydrate to fats, and a carbohydrate with fiber, carbohydrates with a lot of fiber should be taken, and complex carbohydrate should be taken so that they don't convert it to glucose very fast, and pancreas need not work too hard. So pancreas, give rest to the pancreas, take complex carbohydrates. So my suggestion always will be, please stop rice, any type of rice, please stop rice, stop wheat, stop maida, and stop sugar completely, no sugar at all. And sugar cane, the jaggery which comes from sugar cane, you can take the jaggery which comes from palm tree, you can take little bit, but don't take these 5 things. And please shift to millets, because millets are small grains and they have a lot of fiber. So 9 to 12% is the fiber content in millets. Please try to shift to millets and health will be perfectly normal. Millet diet, carbohydrates, only millets, not rice, not wheat. Rice and wheat, these are the main rice, wheat, sugar and jaggery. These are 4 things which are the main culprits, and even maida also. Maida is very dangerous, and these are the main culprits. Please shift to millets as early as possible. You need not wait till you are 60 years. I am already 60, my age is 61 now. But please don't wait till that time. Please shift to millets as early as possible, because nowadays heart attacks are coming at the age of 31, 32, etc. So please, as early as possible, try to shift to millets which have very good fiber. Every millet has got so much of fiber covering, so that it takes a lot of time for the millet to slowly get converted to glucose. It goes inside, slowly it gets released. Glucose release is very, very low. Pancreas gets sufficient time. All the things, obesity, thyroid, your sugar, hypertension, all these things can be reversed, can be made normal. So be cautious about this, and don't go for multiple tests. Only basic things which I told you.